You spent a lifetime learning what works for your body. You've weathered the storms of bad diets, miracle pills, and ever-changing health fads. But here's something that might shock you. Some of the vitamins you've trusted for years could actually be hurting you, especially now that you're over 60. That's right. What used to work for your body in your 30s or 40s may now pose silent risks. The truth is, your body changes drastically as you age. Your metabolism slows, your organs become more sensitive, and nutrient absorption changes altogether. This means some healthy habits could now be toxic traps. Have you ever felt more tired after starting a new supplement? Or noticed strange side effects and couldn't pinpoint why? It might not be aging. It might be the vitamins you're taking. Dr. William Li, a world-renowned physician and medical researcher, has been raising red flags about this very topic. According to him, many older adults are unknowingly putting themselves in danger by continuing certain supplements that no longer match their biological needs. The problem isn't just unnecessary spending, it's the quiet damage that can accumulate in your organs, brain, and immune system. But don't worry, we're not just here to scare you. We're also here to empower you. In this guide, you'll discover 4 common vitamins that could be doing more harm than good after age 60. More importantly, you'll also learn which 4 vitamins your body craves daily to maintain energy, protect your brain, and even reduce the risk of disease. For years, vitamin E has been hailed as a miracle antioxidant. It was marketed as a heart protector, a cancer fighter, even a skin savior. You probably saw it in nearly every anti-aging supplement bottle, and maybe you even took it religiously. But here's the inconvenient truth. Vitamin E might be dangerous, especially when taken in high doses. Multiple large-scale studies, including one from the National Institutes of Health, have found that vitamin E supplementation, particularly in synthetic or high-dose forms, is linked to an increased risk of prostate cancer in men and higher chances of stroke in both men and women. Even more alarming, it offers little to no benefit for those without a clear deficiency. Why is that? The body thrives on balance. While antioxidants like vitamin E fight free radicals, too much can actually disrupt the delicate oxidative process your body uses to destroy abnormal cells, including precancerous ones. Oversupplementation essentially disarms your body's natural defense mechanisms. And there's another catch. Vitamin E is a fat-soluble vitamin, which means your body stores the excess in fat tissue and the liver. Unlike water-soluble vitamins, it's not easily flushed out. Over time, it can accumulate to toxic levels without you even realizing it. But I'm just taking what the label says. That's the trap. Most commercial vitamin E supplements contain doses far higher than what the body needs, especially if you're already getting some from a balanced diet. Here's what Dr. William Li recommends. Get your vitamin E from food, not pills. Nuts like almonds, seeds, spinach, and avocado offer vitamin E in a natural, balanced form your body can actually use safely. And unless a doctor has identified a deficiency, skip the capsule. Still think more is always better? When it comes to vitamin E after 60, less might actually save your life. If you've ever felt the stiff ache of aging joints, someone has probably told you about glucosamine. Marketed as the ultimate joint support supplement, it's found in nearly every pharmacy aisle and often recommended by friends, doctors, and fitness gurus alike. But what if that daily pill you take to keep your knees moving is quietly putting your heart in danger? Glucosamine is a natural compound found in cartilage, and in theory, supplementing it should help slow joint wear and tear. But here's the truth many don't hear. While some studies show mild benefits for osteoarthritis symptoms, there's growing concern about glucosamine's impact on cardiovascular health, especially in older adults. A 2019 study published in the British Medical Journal followed nearly 500,000 people and found that regular glucosamine users had a 15% increased risk of cardiovascular disease, particularly heart attacks and strokes. While the study wasn't conclusive about causation, the association was strong enough to raise alarms among researchers. Why the risk? Glucosamine may affect blood sugar metabolism, leading to insulin resistance in some individuals. For people over 60, many of whom already struggle with prediabetes or metabolic syndrome, this can silently elevate the risk of heart issues. It may also interact with blood thinners like warfarin, increasing the risk of dangerous bleeding or clotting events. What makes this supplement especially tricky is how it's marketed. It doesn't feel like medicine, it feels natural. But natural doesn't always mean safe, especially when taken daily, long-term, and without guidance. So what's the alternative? Dr. William Li emphasizes the power of anti-inflammatory foods over questionable supplements. Omega-3, rich fish like salmon, turmeric, olive oil, and dark leafy greens can do wonders for joint health without harming your heart in the process. Before you reach for that glucosamine bottle tomorrow morning, ask yourself, is the joint relief really worth the silent risk building in your arteries? Before you reach for that glucosamine bottle tomorrow morning, ask yourself, is the joint relief really worth the silent risk building in your arteries? It's marketed as essential for healthy vision, glowing skin, and a strong immune system. And that's partly true. Vitamin A is crucial for many bodily functions. But there's one thing the supplement industry doesn't often say. Too much vitamin A can quietly destroy your bones and liver, especially after 60. Vitamin A is a fat-soluble vitamin, meaning it accumulates in the body over time. Unlike water-soluble vitamins, like vitamin C or the B-complex group, which are flushed out through urine, excess vitamin A is stored, often in your liver and fat tissues. That storage can become toxic, especially with daily supplementation over months or years. One of the most concerning risks is bone loss. Numerous studies have linked high levels of vitamin A intake to reduced bone mineral density, increasing the risk of fractures and osteoporosis in older adults. For someone in their 60s or beyond, whose bones are already naturally thinning, this can turn a small fall into a life-altering injury. But that's not all. Excess vitamin A is also known to cause liver toxicity, which may go unnoticed until damage is advanced. Symptoms like fatigue, nausea, or joint pain are often mistaken for aging, when in fact, the culprit could be sitting in your medicine cabinet. And here's the tricky part. Vitamin A is often hidden in multivitamins, liver-based supplements, or even skin products marketed as anti-aging. Combine that with a diet already rich in animal products like liver, eggs, and dairy, and you may be ingesting far more than your body actually needs. According to Dr. William Li, the safer alternative is beta-carotene, a precursor to vitamin A, found in colorful fruits and vegetables like carrots, sweet potatoes, and spinach. Your body converts it to vitamin A only when it needs it, reducing the risk of overdose. So, if you've been taking a daily multivitamin with high-dose vitamin A, it might be time to rethink that habit. Your bones, liver, and long-term vitality depend on it. Imagine a vitamin that supports your bones, lifts your mood, strengthens your immune system, and even reduces your risk of chronic diseases. Sounds too good to be true? Welcome to vitamin D. Often called the sunshine vitamin, vitamin D is technically a hormone, not a vitamin, and after age 60, it becomes one of the most critical nutrients your body needs daily. But here's the problem. Most people over 60 are deficient in it. Why? For starters, the skin's ability to produce vitamin D from sunlight declines with age dramatically. Add in more time spent indoors, sunscreen use, or living in a cloudy climate, and your body may not be producing enough even during the summer months. Dr. William Li emphasizes that vitamin D isn't just about bones, though it certainly helps prevent osteoporosis and fractures. New research shows that adequate vitamin D levels are linked to lower risks of depression, certain cancers, heart disease, and even cognitive decline. It supports the immune system in fighting off infections and regulates over 200 genes in your body. The signs of deficiency can be subtle: fatigue, muscle weakness, joint pain, but the long-term consequences are serious. In older adults, vitamin D deficiency is a major contributor to falls and fractures, which are a leading cause of hospitalization and loss of independence. So how much do you need? While recommendations vary, most experts suggest 800 to 2,000 IU per day for adults over 60, depending on individual levels and sun exposure. The best way to know for sure? Get your blood levels tested. Vitamin D3, cholecalciferol, is the preferred supplement form. It's better absorbed and more effective than D2. And pairing it with vitamin K2 can enhance its bone-supporting benefits by ensuring calcium goes to your bones, not your arteries. You can also boost your levels through food. Fatty fish like salmon, egg yolks, and fortified products like plant-based milks and cereals If there's one vitamin you don't want to overlook after 60, this is it. Vitamin D is your body's silent protector, and giving it the attention it deserves could change the way you age. Have you ever felt foggy, forgetful, or just plain tired, even after a full night's sleep? You might be low on something your brain and body desperately need: vitamin B12. Vitamin B12 plays a vital role in keeping your nerves, brain, and red blood cells healthy. But here's what most people don't realize. As you age, your ability to absorb B12 from food decreases sharply, even if you're eating a balanced diet. The reason lies in your stomach. To absorb B12 from food, your body needs something called intrinsic factor, a protein produced in the stomach lining. But after age 60, many people produce less of it. Add in medications like antacids or metformin, used for diabetes, and absorption becomes even harder. The result? B12 deficiency is shockingly common in older adults, and it often goes undetected. Symptoms can creep in slowly: memory lapses, numbness or tingling in the hands and feet, muscle weakness, mood swings, or even depression. Left untreated, B12 deficiency can cause irreversible nerve damage and cognitive decline that mimics dementia. Dr. William Li highlights B12 as one of the most underrated nutrients for healthy aging. While many assume they're getting enough from food, like meat, eggs, or dairy, the truth is that older adults often need a supplement to maintain optimal levels. The good news? B12 supplements are safe, inexpensive, and effective. Look for methylcobalamin, the active form of B12 that your body can use directly. Many experts recommend 500 to 1,000 micrograms daily for those over 60, though your doctor can help determine the right dose based on your blood levels. And here's a tip: sublingual tablets, those that dissolve under the tongue, or B12 injections are especially effective if you have trouble absorbing it through your gut. If you've been feeling mentally foggy, low on energy, or emotionally off, don't just chalk it up to aging. It might be your body asking, no, begging for more vitamin B12. If there were a pill that could reduce inflammation, protect your heart, preserve brain function, and even fight depression, you'd want to know about it, right? That's not science fiction. That's omega-3 fatty acids. Specifically, we're talking about two key types: EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, found mainly in fatty fish like salmon, sardines, and mackerel. While some plant-based sources contain ALA, like flax seeds and walnuts, only EPA and DHA provide the full anti-inflammatory and neuroprotective benefits your body needs. And after age 60, those benefits become non-negotiable. Chronic inflammation is behind many of the diseases that affect us as we age: heart disease, arthritis, Alzheimer's, even certain cancers. Omega-3s work by calming the inflammatory response, protecting blood vessels, and supporting the flexible function of your cell membranes. But it doesn't stop there. Your brain is nearly 60% fat, and DHA is one of its primary building blocks. Supplementing with omega-3s has been linked to improved memory, better mood, and slower cognitive decline in older adults. Some studies even suggest that high omega-3 levels may delay the onset of dementia. Still not convinced? Omega-3s also help regulate blood pressure, reduce triglycerides, and prevent dangerous blood clots. In other words, they're doing heavy lifting in the background, quietly extending your health span, not just your lifespan. So how much should you take? Experts often recommend around 1,000 milligrams of combined EPA and DHA daily for adults over 60. If you don't eat fatty fish 2 to 3 times a week, a high-quality fish oil supplement is a smart move. Just make sure it's purified and tested for heavy metals. You don't want mercury along with your medicine. Prefer plant-based? Look for algae-based omega-3 supplements, which provide DHA and EPA without the fish. In a world of flashy supplements and miracle claims, omega-3 remains a quiet champion, grounded in science and backed by decades of research. You may not think much about magnesium, but your body does. This unsung mineral is involved in over 300 enzymatic reactions, touching nearly every system in your body, from regulating muscle contractions and blood pressure to calming the nervous system and supporting sleep. Magnesium is a master multitasker. And here's the kicker: up to 80% of adults are deficient, and the number gets even higher after age 60. As we age, magnesium absorption decreases while losses through urine may increase, especially for those taking common medications like diuretics, proton pump inhibitors, or certain antibiotics. Combine that with a diet low in magnesium-rich foods, and deficiency becomes not only possible, but likely. The symptoms are subtle but widespread. Muscle cramps, restless legs, anxiety, insomnia, constipation, even irregular heartbeat. Sound familiar? Dr. William Li calls magnesium a calmness mineral for a reason. It helps regulate cortisol, your stress hormone, promotes deeper sleep, and balances your nervous system. That means better energy during the day and better recovery at night, something many older adults struggle with. Magnesium is also crucial for heart rhythm stability and bone health, working in tandem with calcium and vitamin D. Without enough magnesium, these other nutrients may not function properly, no matter how much you supplement. So where can you get it? Great dietary sources include leafy greens, almonds, black beans, pumpkin seeds, and dark chocolate. Yes, really. But given the high rates of deficiency, a supplement is often necessary. Look for forms that are easily absorbed, like magnesium glycinate, citrate, or malate. Avoid magnesium oxide. It's poorly absorbed and often used as a laxative. For sleep support, magnesium glycinate or magnesium threonate, which crosses the blood-brain barrier, are ideal. Typical doses range from 200 to 400 milligrams per day, and it's best to take it in the evening to support relaxation and sleep. If you've been feeling tense, tired, or off balance, magnesium might just be the missing piece of your wellness puzzle.